right, welcome back. Thank you so much for staying with us. You're watching TV47 Breakfast. If you're just joining us, my name is Annie Odida. It's a very, very cold day in Nairobi today. But I want us to shift gears now and talk matters health. Being a Thursday, we focus on health every Thursday. Today, we are looking at cleft lip and palate deformities. What is this condition? How do you get it? What are the diagnoses? Who gets it? Who don't? 1 in every 700 babies have a deformity according to WHO, and we're going to find out how that data is looking like as of 2026, if at all there's an increase or decrease in babies being born with cleft lip and palate deformities. So we do welcome you to be part of this conversation on our socials, TV47 Kenya on Facebook and on YouTube. On X, it's TV47 Digital. You can tag me as well at Annie_Dida. If you want to send in a message, 0793 267 279. That's our WhatsApp line. And if you also want to call in live, there will be a number on your screen very shortly. With me in studio is Dr. Karenji Julius. He is a medical officer at St. Francis Community Hospital, Kasarani. Karibu sana.
Thank you.
This is TV47 Breakfast. Your first time?
Yes, it is.
Great to have you on set. We want to learn about cleft lip and palate deformities. And just as I've said, learn, because usually we love to simplify such technical conversations for our viewers. Cleft lip and palate deformities. What is this? I do understand that when we say and, cleft lip and, it means there are two different things, right?
Yes.
So just walk us through what these are.
Okay, thank you for having me. So cleft lip and palate, as you have rightly said, they are two separate conditions that can occur differently, and they can co-occur, meaning that they can happen together. So cleft lip, it is an opening or a slit in the upper lip, and cleft palate is an opening in the palate, that is the roof of the mouth, and that this condition occurred due to failure of fusion of parts of the face and the mouth during pregnancy. That is early in pregnancy. So as you've rightly said, so we have 1 in 700 babies being born globally with these conditions.
Yeah.
And that is about every 3 minutes a child is being born with cleft conditions.
Globally?
Globally, that is. Yes.
How is the data looking like in Kenya? If 1 in 700 billion is the data in the world, then 1 in 700 babies, I said 700 billion. So how does the data look like in Kenya?
So the data is, if you look at the subset of our population, the data is almost similar. We have, like for cleft palate, 1 in 2,000, a cleft lip, 1 in 1,000. It is one of the most common facial deformities that a child can be born with. Yes.
All right. So I would care to know if 1 in every 700 babies have a deformity. Do you see an increase in the cases of cleft lip and palate deformities, or there's some sort of decrease in these conditions in Kenya? So
if I understand your question correctly, you're asking in comparison to the data subset globally and in Kenya?
No, as of 2026, right?
Yes.
And maybe in the last recent years,
yes.
Do we see an increase in the number of kids being born with this condition?
Yes. So yes, so definitely there is an increase in recent years. And this is because of several reasons. So it is worth noting that cleft lip and palate has always been there. So the numbers have almost always been similar, but of course now we have better health seeking behavior. So more children present to hospitals. We have social media, like and general media, like what we are doing here, to amplify these conditions, and this has increased the numbers of people and the numbers of parents taking their children to hospital, and so the data is better captured. So yeah, for that reason, there is an increase in the number.
How is the level of awareness across the country? Because I know now you're saying that the health systems are now here to take care of the kids who are born with the cleft lip and cleft palates.
Yes.
But level of awareness at the grassroots level, you know, to communities and then parents who also give birth to kids who have such deformities. How's the level of awareness?
In the grassroots, the level of awareness is still actually alarmingly low. Because you know, there are several, I think it is a condition. It's actually unfortunate that despite the fact that it is one of the most common conditions that children are born with, that is, we call them congenital anomalies. They are conditions that occur in pregnancy. So despite that being one of the most common, it is still actually, the information out there is still actually very low. So that you find that parents do not take their children early enough, and they are not to blame. It's actually due to the low level of information. So I think there is still a lot that can be done with regards to improving the information on the condition.
How about the level of stigma? Has it dropped, or is it something that is increasing day by day?
It's actually still there. Yeah, it's actually still there. The level of stigma is there, and it is very unfortunate. Actually, one of the major problems, because you see that in most cases, because the parents didn't, because the parents are not aware that it is a treatable condition, and that if treated early, a child can live a normal life. You find that they are still adults with the condition. They are still teenagers. Basically, at all ages, there are people affected by these cleft conditions. And one of the major problems they go through is stigma. Actually, in school, you find the children getting bullied in the society because there are still myths and misconceptions that exist. You see, we live in a traditional African society. We are Africans, and Africa is our business. And you find that one of the things, we are superstitious people. And so out there, people believe that it is actually a form of a curse or a punishment, which actually is not true. It is a medical condition like any other. Yes, so yeah, the level of stigma is still quite there.
So I want us to pick up from that point on myths and misconceptions. You've talked about something, it's a curse. Walk us through some of these myths and misconceptions that are still existing despite some sort of awareness about cleft lip and palate deformities.
Yes, so the myths and misconceptions still exist. For instance, most people in the society, actually you'll be surprised, even both in rural areas and even in urban areas, most people still believe that it is actually a curse, that it's because maybe you didn't do this or didn't do that. Most people actually believe that it is caused by evil spirits. Most people actually believe that it is not a treatable condition, which that is one of the major misconceptions. So everything I've mentioned is a myth and misconception. The truth of the matter is that cleft conditions are medical conditions like any other. And these medical conditions, they are not a form of punishment, and they can be treated. Yes, and that is why we continue to impress that parents whose children have this condition should take their children early to hospital.
Speaking of myths and misconceptions, you know, now courses have come up there because you say some would think that it's a curse, right? So what are the causes or factors that may contribute to a child being born with a deformity, a cleft lip?
Yes. So it is worth noting that the exact cause is often not understood. But however, there are things that we know about the causes of the condition. For instance, we know that it is a combination of both the genetic factors and the environmental factors. Genetic factors, we're talking about family history here. That say, maybe now in my family, if we have children with cleft conditions or people born with cleft conditions, then there is a high likelihood that another child either later on can be born with cleft conditions. So that is the genetic bit of it. In terms of environmental, there are several causes. Number one, folate deficiencies. So you get that, actually that's why we advise people to seek antenatal care. So that you find that folic acid is one of the major supplements
Yeah.
that is given in pregnancy. And deficiency of it, it's given before and during pregnancy, especially early in pregnancy. Deficiency of it can cause these cleft conditions. Number two, we have use of alcohol in pregnancy, use of nicotine, that is smoking, in pregnancy, other conditions like diabetes mellitus in pregnancy, and use of other medication like anticonvulsants, that is drugs like phenytoin, carbamazepine, you know, basically the drugs that help reduce the seizures. Those are the anticonvulsants. So yes, so that is, those are some of the major causes of the condition.
So if at all there's no cause that is, you can point out that this is the exact cause of this particular deformity, then what do you say to parents who, I'm thinking maybe there's a parent who they've just given birth to a baby with a cleft palate or a cleft lip, but then they are quite skeptical. They don't want this child. They don't want to go home with them. So how do you explain it to them that, you know, this is why this child has been born like this? You can take them home and this is what you'll do, 1, 2, 3. How do you take them through that process?
Yeah, so as you know that this is one of the major conditions, and it is one of the conditions, unfortunately, that causes a lot of stigma in the society. So the result of that is that the parents especially feel very discouraged, especially when...
Stigma starts with the parents, right?
Yeah, actually that's true. That's true, unfortunately. So that now, so you just walk them through, you tell them that this condition is sometimes, as with other things, it is idiopathic, meaning that nobody really knows the exact cause, so it can just happen.
Yeah.
And you just you let the parents know that nobody is to blame for it. It's not a curse, it's not a punishment. And the most important thing now, of course, as healthcare workers, we are expected to give what is next. We always try to give what is next.
Yeah.
And what is next is that it's important to know that this condition is treatable. That is one. Number two, it is important to know that early treatment, it can be treated at any age, but if it is treated early, it has better outcomes, because as we are going to discuss, there are several complications that result from the condition itself.
And we'll be getting into treatment as well later on, but I was reading about this and I saw that there's a little bit of connection between diabetes and cleft lip palate. That if a mother is diabetic, then the child would likely be born with a cleft lip or a palate deformity. How true is that? Yeah,
that's very true. Actually, one of the established risk factors for developing these cleft conditions is mothers with diabetes. Either they have diabetes before pregnancy, or there is a type of diabetes that occurs in pregnancy called gestational diabetes, and this interferes with the growth of the normal growth of the organs early in pregnancy. So yeah, you are right, that is very true. Yes.
Walk us through how early can treatment be done, because you said the earlier the better.
The better.
So how early is early?
So as we discussed, we have cleft lip and cleft palate.
Right.
They can occur differently. Cleft lip differently, cleft palate, sometimes they can co-occur.
Yeah, I want you to hold on to that point, because now there's a lot that we need to break down. Paint a picture for us how a cleft lip look like and how a palate look like, because I do understand there's one that is quite hard to see because it's inside the mouth.
Yes, that
then
is
paint that picture for us how it looks like.
Yeah, okay. So cleft lip, it is in the upper lip. So that is a slit or a gap in the upper lip, and that is usually actually seen. It can be seen early in pregnancy through the prenatal scans, the obstetric scans. But now cleft palate, on the other hand, it is a gap in the roof of the mouth. So you see now that can be difficult to see.
Yeah.
While actually during pregnancy. Yes, and then to answer your question, we said the early the better.
Yeah.
So for cleft lip, children can be treated from up to 3 months, up to 3 months of age. Of course, there are several things that we screen for. For instance, like weight. I mean, it's important they have a birth weight of at least above 5 kilograms. For cleft palate, it is usually treated from around 9 months, and we at least expect a weight of at least more than 10 kilograms. So where there is cleft palate, either co-occurring with, so they can be treated sequentially, but for cleft palate it's more than 9 months. For cleft lip is 3 months, even as early as 3 months.
Yeah. So are these two painful in any way when a child has them? Is it painful?
So by themselves, they are not painful, but now the result, what they cause, now becomes painful.
Now talk to us about the conditions that may be brought about by the fact that a child may be born with these two conditions.
Okay. Yes. So these conditions, when we say that they should be treated early, it's because of the sequelae. For instance, number one, it causes feeding difficulties. If you just think about it, for a child to suck, they need to create a negative pressure. So with cleft lip, you see there is an opening, so they are not able to create that negative pressure. So you see now sucking becomes difficult. The result of that is some children are not able to feed properly, and so they can get severe malnutrition. So that is one of the major problems. Number two, we have language and speech difficulties, where these children are not able to speak at the right time, and this can especially cause a lot of distress to the parents and even the children themselves. And number three, it causes dental problems. It can also cause recurrent ear infections, which can actually be fatal. And number five, it usually causes psychological problems. Yes, where now you find what we've been talking about, the mental health part of it. Yeah, so those are some of the common problems that occur with the cleft conditions.
Psychological problems on kids?
On kids resulting from, you see, the kids themselves.
Say, for example, it was fixed, you know, at around 3 months, right? And it's something that he or she has grown up as just a normal child, but of course, in one way or the other, he or she was told that, you know, you had a cleft lip, and we had that fixed. Then how do they now develop a psychological issue?
I know. Well, if after treatment, actually, treatment of this condition is actually quite highly specialized, and it involves a wide team of healthcare workers, surgeons, pediatricians, et al. And you find that it is usually done so well, or it is usually fixed so well by these professionals, that actually, if a child had a cleft lip or cleft palate, after treatment, they can lead normal lives. So yes, treatment actually greatly reduces
the psychological impact.
Yeah, or actually even eliminates the psychological bit of it. The psychological bit is now for children who haven't yet been treated. Yes.
Speaking on feeding, you know, being a challenge to, you know, these kids who are born with cleft lip and palate deformities, what other techniques can be used to feed such kids?
Yes, actually that is very important, and that's why we say it's important that children, that parents seek medical help early. So the feeding techniques that can be used for children now with cleft lip, there are specialized feeding bottles with teats that are usually wide at the base, and also now with a big hole to allow the milk to easily pass, or the feed to easily pass. Another thing that can be done, sometimes the children's cheeks can be pressed to try and create that negative pressure. That is for cleft lip. For cleft palate, you see there is already a connection with the nose, and so for that reason, these children are usually fed while upright, and they are usually, again, special feeding bottles that exist with a one-way valve, and that make it easy for the milk to pass through. Also, remember with cleft palate, because of that connection with the nose, children swallow a lot of air as they are swallowing the milk. So it is important to burp the children frequently. Yes, so those are some of the techniques that can be used.
Yeah, I'd love to understand the connection between a cleft slip and palate deformity with now the ear. That now it causes also hearing implications to the child. How are those two connected?
You see, it is so there is a connection that exists between the mouth, that is the oral cavity, the nose, and the ear, through small connections, so to say, like small tubes. So now, because a child is feeding, and you see the milk or the feed can regurgitate, through that connection, it can cause that kind of infection because of that regurgitation.
Yeah. And when you talk about there's some adults who don't get treatment early and they end up living with this condition for long, then how is the quality of life? How is the feeding like? How is the hearing like? How is the health like?
Generally, the quality of life is quite very poor, I must say, because of those things we've talked about. So you find adults with speech difficulties, maybe children, of course, because they have had malnutrition, so they didn't thrive properly. You can have children because of recurrent ear infections. Now they have hearing difficulties. Yes, because of growing with the condition, there is still the mental health part. So you find that they can tend to have, it's not a must, but they can tend to have low self-esteem, which is actually quite unfair. Yes, so they live a very poor quality life. Yeah.
Can the treatment be done, say, for example, for a 20-year-old or 21-year-old? Can it be done then?
Yes, it can be done.
Then how different is that treatment procedure for an adult, and how different is it for a child?
Of course, for a child, it becomes quite
easy.
Yes, it's not as technically difficult as that of an adult, but it can still be done. It doesn't mean that there is no hope. Yes, it can still be done.
All right. So, at what stage of pregnancy does this condition develop? Let's go back to that point. Let's go back now. At what stage of pregnancy?
Basically, in pregnancy, these conditions happen early in pregnancy. By the 3rd week of pregnancy, there is a process called gastrulation, where now the organs start to form. So anywhere by around 12 weeks, that condition can usually be seen. Yes.
That is with an ultrasound?
Yes, on an ultrasound.
So, sometimes I hear moms are given options if, of course, a child has some sort of deformities. Are these options that you give to moms who clearly indicate on an ultrasound or scan that, this child has some sort of deformity and they face a cleft lip or anything of that sort?
By options,
sometimes they tell you that, well, this child is going to live with, to live a very hard life. But I know you've said it's a treatable disease. It's very easy to be treated. But is it something that you let parents know from a very early age, or a very early stage?
Yes. So while we are giving them options, the only option.
And then what are these options when you're giving them options?
Actually, it's good to inform them early so that they can be prepared and that they are not surprised when now they finally, because some of this, in as much as we say that the ultrasound usually catches it early, you can actually go through the whole pregnancy, and so it's actually good so that they are not surprised by the condition and they are mentally prepared. And the only option we give them is that, of course, go through the normal pregnancy, deliver, and now, of course, now that it is known, it becomes easy even now to advise them on the feeding techniques, to teach them these techniques as we wait for 3 months so that we can correct it for cleft lip and 9 months for cleft palate. So the option is to go through pregnancy, and because it is very treatable, so that it's treated early. Yes.
Perhaps are there types of cleft lips and palate deformities, types in, details, that a cleft lip has different types of cleft lip, and then palate deformities has different type of palate deformities, and then can they be mild to severe conditions?
Yes, actually they can be. Because now if you go into detail, so cleft lip, so it can be complete or incomplete. So if it is incomplete, the opening doesn't usually go into the nostril. That is incomplete. If it is complete, the slit goes all the way. It involves the nostrils, this part of the body. It can also be unilateral or bilateral. So it can be one side or both sides. That is for cleft lip. For cleft palate, it can be again complete or incomplete. So if it is incomplete, it usually involves the hard palate. So if you look at the roof of the mouth, there is a hard part and there is a soft part. The hard part is at the front, the soft part is at the back. So for the incomplete, it involves the hard part, the hard palate. For the complete, it involves the whole length of the roof of the mouth, so the hard part and the soft part. Yes, and it can also be unilateral, it can also be bilateral. It can, both cleft lip and cleft palate can occur together, so that actually becomes even more challenging. Yes.
So perhaps is there anything that expectant mothers can do to reduce the risk of this child being born with a cleft lip or a palate deformity? Because I'm assuming if you discover it early, you said 3 weeks, thereabout, if at all it's but at 3 weeks.
3 weeks. I said from at least somewhere from 12 weeks going forward.
12 weeks going
but forward. It's at around 20 weeks. It can be. Oh,
you are saying that for 3 weeks now the child is forming.
That is when the organs start to form. Yes. So you see, there are things called prominences now. That is where now medicine gets quite deep. But during development, there are usually 5 prominences in the face, and usually these prominences, they actually join together later in pregnancy. Yes. So if they do not join, these facial prominences, for instance, now we have the maxillary prominences, the frontonasal prominence. If now they do not join later in pregnancy, so that is when these conditions occur.
Just hold on to that point, Dr. Let's get this call from our viewer Paul Kamau, watching us from Kayole. Paul, good morning.
Hello, good morning.
Yes, how are you today?
Yeah, I'm very fine. Thank you very much
for
the program today.
Yes.
Indeed, I've even written it, God said. Thank you very much. So I'll request for the panelists, maybe by the end there, because he has already answered some of the main questions, to talk about the hospitals or the specific clinics where people can get attended, because I'm having just the same kind of case. And we have contradicting information from various clinics, I don't know, Kijambe, Kenyatta, anywhere, and mostly that they come from the slums. I prefer maybe a clinic or a hospital where I can use SHA. Please,
all right. Paul, is it a child or is it you?
A child who is now 2 months.
All right.
Sawa.
Thank you so much. Please just keep watching. Stay right there. If at all the answer that Dr. won't give you is not enough for you, you can then call in again. Dr. let's just pick up from that point, Hospitals and clinics that Paul here can take the child. Anasema 2 months. Is 2 months too late?
I know 2 months is not too late. Actually, we said that for cleft lip, it can be treated even as early as 3 months. So actually, to answer Paul's question, I work in St. Francis Community Hospital, Kasarani, And one of the upcoming programs that we have is that we are partnering with Smile Train and CRISPAS, that is Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons. And through the partnership of the three, we are offering actually a free surgical camp dealing with cleft lip and cleft palate. So at the end of, I don't know at what point, but there are numbers that will be displayed there from St. Francis Community Hospital, Kasarani. The camp,
you'll give us the numbers?
Yes,
okay.
I will. So the camp is happening between 21st and 27th. I will actually...
Of June?
Yeah.
Of June?
Yeah.
That is from Sunday?
Yes.
Okay.
Yes. It's happening between 21st and 27th. I will actually implore Paul to call those numbers for booking, to show up with the child on 21st. And it's actually happening free of charge. And it is not only limited to children, actually even adults. So on that day, 21st, there will be screening, and then now the surgeries will begin. Yes, so it is... so I will actually implore Paul and any other viewer with the same who is affected or know someone who is affected to actually give them this information. Yes.
All right, Paul, please call back again. I'd love to know your reaction when you found out that the child has a cleft lip, as we continue to talk about this discussion. And I hope Daktari has given you an answer free of charge. Sindio?
Actually,
Daktari?
free of charge. Free
of charge, Paul. So we'll give you that contact later on the show, so keep watching. But before, Paul, you are responding to some of the things that expectant mums could do to reduce the risks of a child being born with a cleft lip.
Yes. So one of the things that mothers can do is to attend antenatal, the antenatal clinics. Those are the ANC clinics. And because for instance, one of the things we said that can cause is folate deficiency. So if before the pregnancy and during the pregnancy, the mothers are usually given these folate supplements. So that is one of the things they can do. Another thing that they can do is, as we said, some of the conditions like diabetes, if they can be better managed. Yes, but it is again important to note that mothers can do all these things and still end up with children with cleft lip and palate. Again, they shouldn't be discouraged. They shouldn't get discouraged, that is. But yeah, it's important for mothers to attend antenatal clinics. Are there cases where a cleft lip deformity or a palate deformity has been discovered just after the child is born and not when, during the pregnancy stage? Yes, actually, it's important to note that in as much as, especially for cleft lip, it can be discovered early in pregnancy. Most of the times, it is actually discovered after the pregnancy, so that now the parents bear a child and then they realize there is a gap in the mouth or in the lip. So actually, in most cases, that's what usually happens. Right. What is the primary treatment for a cleft lip and, of course, a cleft palate? So the definitive management is surgery. And that's what we were talking about, that it can be done as early as 3 months for children with cleft lip, as early as 9 months for cleft palate. And it is also important to note that after treatment, children can actually lead normal lives, devoid of these problems we were talking about. Yes, it is very treatable, and yes. I'm trying to think about it this way, that you fixed a cleft lip at around 3 months, thereabout, and then the baby is able to grow into a young man or a young lady, and then they get to, say, 21 years of age. Then do they then go back to surgery, or once surgery is done at 3 months, then that's it? Because you mentioned something about it also affecting the teeth. Yes. So I know as they grow, then teeth also grow. Then is one surgery the done deal, or do they do it again as they grow? Actually, for these surgeries, that's why we are actually advocating for the parents to take their children early, because it can prevent or greatly reduce some of these problems, like dental problems. So once the surgery is done for cleft lip or cleft palate, once it's done, that is definitive. That there will be, in most cases, no need for follow-up surgeries. But even after the surgery, mothers should still continue with follow-up clinics, so that any problems that arises after that, they can be addressed. Yeah, but the surgery is definitive. It's one time, yes, unless there are other complications which we don't, which the specialists are well trained to handle and to prevent these complications.
Because I was listening to a story of this very beautiful young lady. She was saying hers was fixed at exactly 3 months, but then now as she's grown, then she's required to go for another surgery to fix whatever is wrong with the teeth. Then what could have gone wrong for her to require another surgery to fix the dental structure and formula?
Actually, that is one of the major complications of these conditions, is the dental problems. So in as much as most times, once the surgery is done, especially at a very early age, the dentition usually happens well. But at times, especially now, at times it can be done and still there are complications. So I wouldn't say that it is exactly something that went wrong. You see, people respond differently to these kind of treatments, and it can happen actually. Yeah, even after the treatment, dental problems still happen, and that's why they should be followed up. Yeah, so it's quite possible.
What types of complications are we talking about here, and how common are these complications as of 2026, with, of course, health facilities sharpening up their capability to tend to kids who have cleft lips and palate deformities?
Yeah.
So how common are these complications?
By complications, I understand that you mean complications that result from
after surgery.
After surgery.
Right.
So, like, especially when, as with every surgery, there are complications that can happen, and these are not solely based on the cleft lip and palate surgeries. For instance, some of the complications that can happen, and which people will be told, you're supposed to be told prior to the surgery. So you can have complications with, like, infections, bleeding, the slit can recur. But
a slit can recur?
Okay, the repair may not, in some cases, but allow me to say that, again, as I said, it is a very wide team of specialists that involves pediatricians and surgeons and nutritionists and general doctors and nurses, and they are very well trained to handle the surgeries. And in as much as I'm saying these complications can happen sometimes, it is worth noting that it is a very, very, very small percentage that happens. In most cases, children are treated, they go through their surgeries, and they live quite a normal life. Yes. Yeah.
I want us to go back to that point of slit can reoccur. What would, for the purpose of education, right, and awareness, what would lead to a reoccurrence of a slit? Perhaps is it smiling too much? Is it talking too much? You know, some of this, this could be a misconception.
Oh, okay.
But then what would lead to a slit reoccurrence?
Okay, so when I talk about a slit reoccurrence, I'm not talking about that now a surgery has been done, and then many months down the line, or at many weeks down the line, or many years down the line, now there is a recurrence. No, that's not what I'm talking about. So there is usually, when I talk about the surgery, like when you come to our camp, that will be happening that between 21st and 27th, in St. Francis Community Hospital, Kasarani. After the surgery, there is care that should be done after the surgery, and mothers will be advised on how to better care for their children. For instance, that's why I said nutritionists. It is in the purview of nutritionists, but part of the feeding that can be done is, say, like feeding by use of syringes, because if the surgery has been done, the scar is still very fresh. We're talking about day 1, day 2, day 3 after the surgery, and the child is still like sucking, creating like that kind of a movement. You see, it can disrupt the surgery. But that one, you will be, the parents or the families will be properly advised on how best to take care of that and prevent that kind of a complication from occurring. But just to clear the air, it doesn't mean that a surgery will be done now, many months or many years down the line or many weeks down the line, it will recur. No, actually that is not what I mean.
So talk to the people who maybe are not directly affected, but they'll just love to know how parents now care for kids after surgery, because you're saying, you know, it's still fresh. Maybe feeding will still be hard. Then how do they now feed these kids? What do they eat?
So yes, so in most cases, if it's done at 3 months, you see the child is actually still exclusively breastfeeding. So they are fully depending on the mother's milk. Sometimes even formula milk. Let the pediatricians not hear me saying this, but anyway, so we are basically talking about milk. At that point, they can still be fed with milk in the first few days after the surgery, maybe through droppers, through syringes. If now as adults or children who have older age, they will be advised by the nutritionists, but it's mostly has to do with like blended food, just to avoid something that will put a lot of pressure or a lot of disruption to the surgical site, and the surgical site, of course, being the lip and the roof of the mouth.
Dr. I'd love to know, you know, for people who are not able to come all the way to Nairobi, right? And they do have public hospitals, say, and the ones in Kisumu, in Nakuru, in these cities, Jaramogi Oginga Odinga. Are public hospitals equipped to solve cleft lip issues and palate deformities? And is it free of charge, or how is that done actually?
So actually, to answer your question, actually yes, most public hospitals are quite well equipped to handle these surgeries, and especially when I talk about big hospitals, I'm talking public hospitals, I'm talking about the big hospitals, level 5 and level 6 facilities that I will not go into. And yes, they are well equipped, and the goal is, if you have a child with cleft lip and palate, just take your child to the nearest medical facility, be it public, be it private, especially now for whatever kind of facility, because even if they are not well equipped at that particular point in time to handle these surgeries, they will refer you to a better to a center that is better equipped. So the most important thing is that a point of contact with healthcare workers at any level. Yes, but to answer your question, yes, there are other hospitals that are like the ones you've mentioned. They are well equipped.
So what's the cost of treatment? For you, it's free, but looking at it, because you know when Paul called, I was saying that he wants a hospital that will allow him to use his SHA insurance. Then what is the cost of treatment for other hospitals?
With regards to the question of treatment,
yes,
you will allow me not to answer the question.
Why?
No, because I will be giving you rumors, because different hospitals have different ways in which they finance.
How about the range?
They finance this treatment.
Yeah.
Yes, I think that one the parents will be told at the hospitals which they go to. Yeah, let me not preempt financial services.
And I'm asking this because I'd care to know how affordable this procedure is, especially for Kenyans who are not quite privileged enough financially, and they have kids, they've given birth to kids who have cleft lips and palate deformities. If at all it's a medical procedure that anyone who is not doing quite well financially, because we know that a lot of 40% of Kenyans are living below the poverty line.
Yeah.
So if at all these 40% of people, we have moms who give birth to kids with such conditions, then what are the chances that they'd get help? How affordable? Is it affordable or?
It's actually, okay, just to answer your question, it's actually very affordable. Yes, it is very affordable. I believe that it is covered within the scope of SHA. So any parent with this insurance of SHA or other private insurance, but in this case I think we are talking about parents with SHA, it should cover all or part of the treatment. Yes.
All right. And of course, World Cleft Day is marked every day on the 12th of July. I care to know if you're able to attend such events as St. Francis Community Hospital, Kasarani.
Yes.
And of course, I know this is a day that is organized by Smile Train, right?
Yes.
So is it a day that you're able to attend, and how is the reception from everybody who plays a part? People with kids who are affected, doctors, everybody, every stakeholder. How is that reception?
Yes, so it's a day that we actually mark cleft lip and palate.
20th July.
Yeah, yeah, and yes, there are several events that are usually organized by both Smile Train, by St. Francis Community Hospital, Kasarani. So there is good reception. It's good that both the affected, the parents who are, or the part of the population that is affected, and even unaffected, come and attend these conferences and these symposiums and these events, so that they are better given information on how to prevent it, how to handle the situation if it happens. Yes.
So what would you say to moms as we wind up who have kids with cleft lip and of course palate deformities, and also moms who just found out, expectant moms who just found out that I'm going to give birth to a child who has this condition? What do you say to them this morning?
So actually what I will implore to these mothers who have children, or the parents, let me just call them parents, with these children with cleft lip and cleft palate conditions, is that number one, it is a medical condition. Do not get discouraged. It is not a punishment, and seek medical help early. That is what I would advise them, because these conditions are actually very treatable, and because every child deserves to smile, to speak, yes, and to thrive. Yeah, and also as I wind up, I will also implore members of the public, those who are watching us, that come to the medical camp that we are having between 21st and 27th of this month. You'll be given numbers in which you can actually call and book. Yeah, so yeah, come to the camp at St. Francis Community Hospital, Kasarani. The treatment will be free of charge. Yes.
I might give them the numbers. Just give them the numbers.
Okay.
Yeah.
So I will have to
check?
I'll have to check.
All right, so we can do that later on once the show is done. That is Dr. Karenji Julius, a medical officer at St. Francis Community Hospital, Kasarani. There's a lot of S in that state. We have problems with this. So medical officer, St. Francis Community Hospital, Kasarani. Thank you so much, Dr. for making time.
Yes.
Might you have a parting shot? Or ushaambia wazazi, it's a medical condition, you don't have to worry.
Yes.
You can get treatment.
Yes, and seek medical treatment early. It is a very treatable condition. Yes, and children can achieve cure
Yes.
Yes.
All right, there you have it. A child can live a fully fledged life. This is not a curse. It's a medical condition that, of course, is treatable, according to Dr. Karenju Julius. That brings us to the end of this segment, but do stay right here because Fred is coming back with a different conversation. Remember, this month is Men's Mental Health Month. So who cares for the men? Who listens to the men? He'll be having that conversation with a very big panel here. They call it Mixter Fixer. Who checks on the man? Who checks on everyone? So do stay right here. You're watching TV47 Breakfast. My name is Annie Odida. Good morning.